Hello, everyone. In today's presentation, we are going to talk about the current trends in radiology with AI. So this video will be about an overview of the mammography and the risk factors for breast cancer, a brief overview of the BioRed score used in mammography. We are going to define AI, explain what artificial intelligence is used for, understand the purpose of using AI in breast imaging. It's going to talk about like a refresher on the importance of accurate positioning skills in mammography, and that's because later on I will talk about how AI can help technologists position accurately, describe the pros and cons of using AI in breast imaging, discuss the new trends in breast imaging with AI software, AI assistance in MRI breast imaging, and AI assistance in breast ultrasound. So this part right here is just going to be an overview of the mammography department. We are going to discuss the risks, treatments, preventative care for breast cancer. So if you do not know, mammography is pretty much an x-ray of the breast. It is used to detect breast cancer very early, and it is the most common cancer in women. And then you have different organizations like the ACR and the Society of Breast Imaging recommending that mammograms start at age 40. And even though mammograms are mainly performed on female patients, sometimes male patients come into the facility as well, especially if they have a lump or pain on their chest or breast area that just will not go away. And they do have a 1% chance of getting breast cancer as well. The main purpose of a mammogram is early detection. It's for prevention. Early detection can save lives. So it's always important to get your annual mammogram whenever you are at the recommended age. We have different regulations in the mammography department. So I'm just going over like a background of the mammography department. It's just so you can see how AI can help the mammography and other radiology departments in the future. So you also have your FDA, which is going to regulate the standards for the mammography machines and training for the people who provide mammograms. You have your MQSA. This became the law in October 27, 1992, and is pretty much going to ensure that you have a quality mammography machine for breast cancer detection and to treat it in its earliest stages. And then you also have EQUIP, which is going to just determine how you can provide accurate mammography clinical images. Now we will talk about the major risk factors for breast cancer. Being a female, your age. So older patients have a higher risk of getting breast cancer. Genetic risk factors, your BRCA1 and BRCA2 gene mutations. You have your family history of breast cancer if you have a mom, sister, your grandmother or aunt who had breast cancer, even ovarian cancer. Dense breast tissue, personal history of breast cancer. And if you had some type of abnormal breast biopsy. Now we have our minor risk factors. These are things you can control. With the major risk factors, you cannot control those. So for the minor risk factors, you have not given birth or had a child, having your first child whenever you are older than 30, you did not breastfeed, early menstrual cycle before age 12, late menopause, you're taking those hormone replacement therapy like some type of birth control, weight gain, not exercising, alcohol consumption, being a smoker, Okay, so now we are going to discuss breast cancer prevention. Try to limit or stay away from alcohol, exercise, and try to stay active. Breastfeed if possible. And then try to limit the hormone therapy after menopause. And quit smoking. Routine mammograms, that's very important. So for your breast cancer treatments, you have your lumpectomy or mastectomy, and then you have chemotherapy, which is going to shrink or kill the cancer cells. You have that radiation therapy, which is going to kill the cancer cells. Hormonal therapy. You want to follow up on your mammograms, ultrasound, breast MRI images within at least 3 to 6 months just to see how the medicine and treatments are affecting the breast cancer tumor, seeing if it's working, is the tumor shrinking, if you need to go a longer amount of time with the chemo medicine, or how soon you need to start radiation therapy, if you just need to just get the mastectomy, if you can get the lumpectomy. So these are different treatments. And then if you're wondering how to choose the best treatment option, just always the patient will discuss this with the radiologist and their doctor. So after the images are taken in the mammography department, then the radiologist will discuss the findings and then also communicate those with the doctor or the patient's doctor. And then from there, they will be referred to a surgeon, and the doctor and the patient will discuss when they want to have the surgery, what other imaging tests they need. All right, so more information about breast cancer cases. Screening mammogram is the only breast cancer screening modality with a proven, benefit for the patient. Even though we image the breast under breast MRI and breast ultrasound, that is not used to replace a patient's mammogram. Okay, you have your U.S. Preventive Services Task Force. So their goal is to improve the health of the people nationwide, and they did have new updates that they recommend for women aged 40 to 74 to have their biennial screening mammograms. So they did make this effective in April of 2024. And then you also have a little background about them. At first, they, came about in 2009, where they stated recommended biennial mammograms for women aged 50 to 74, and then selective screening was for age 40 to 49. And then this is just different updates that I got from their website. And if you want to take a look, I have their address at the top right. It will be my right and your left, probably. Okay, now we are going to talk about AI. Okay, so what is artificial intelligence? It's pretty much a software that is going to require human intelligence. So it's going to have that performance, reasoning, learning, decision making tasks that will be performed. And it is used to help free up some extra time for humans. So any difficult tasks humans have trouble with performing, AI is going to help, relieve that stress from us. And there are several jobs that have been created, especially to allow busy workers to send emails, send automatically or automated text messages through AI. So what is it used for? So if you do not know, we use AI every day. So it is used to help ease the stress from things that we do each day. It is available everywhere, at your house, at the store, at your job. And AI software can help with job duties, especially if you're working at a place where it's a short, you're short on the shift, like a staff shortage. Any threats and fraudulent activities, AI can recognize it and maybe help lock your account or flag that someone is trying to commit some type of fraudulent activity. and it can alert doctors and radiologists on any type of abnormality seen on the images. It can assist patients and medical staff with completing their paperwork. Why was it created? So AI, especially when it comes to breast cancer, is very new, and it was created from human intelligence. So if you don't know what human intelligence is, it's the ability to use previous knowledge to adapt to new conditions and to identify meaning and patterns. So it is everywhere whenever you go shopping, whenever you're talking to customer service on the phone, fraud prevention to help you read a book, voice assistant, especially whenever you are speaking into your phone to make a text message to someone, autopilot vehicles, spam filters, whenever you are using your phone to get into your phone and don't have to, punch in your password, it could be used for facial recognition, gaming, advertisement on social media. With in healthcare, AI is used for patient care, medical imaging, diagnostics, research and developing physician. So with patient care, it is going to be used to promote safety, especially through the questionnaires screening patients. You also have in medical imaging, it is going to detect abnormalities instantly. And then for research and development, discovering new drugs and the effects it has on patients, whether it's cancer drugs, diabetic medicine, high blood pressure medicine, weight loss or weight gain medicine, and it's going to help assist the physicians with surgery. In patient care, AI is going to be used to diagnose and provide certain type of treatment outcome, pregnancy and diet management, assist with health and personal trainers. It can suggest the best exercise to either lose weight or gain weight, gain muscle, how you can tone your body. All right, now with medical imaging and diagnostics, so it's going to help provide diagnostic results that are free of errors. It can predict an early diagnosis for cancer detection. It can help the radiologist with flagging any typing errors, and it can alert the radiologist of any abnormalities. Okay, when it comes to research, it's helpful in data mining and analytic, drug discovery, drug design, pandemic detection, and what you need to, combat that virus, vaccine development. Now, AI is very helpful, especially during surgical procedures with the doctors. It could be used for gallbladder removal, C-section, hysterectomy, any type of transplant. So it's very helpful with everything. And actually, people are using AI now whenever they're doing those robotic surgeries, whether it's a C-section or, taking the fibroids out or doing a full hysterectomy. For breast imaging, it's going to be useful with decision support, risk assessment to determine how dense a patient's breast tissue is, to help with workflow and triage, to evaluate the images, whether it's checking for motion, checking to make sure that the technologies included all the breast anatomy, to check and make sure that this image have a nipple profile or this image doesn't. So it's very useful, especially for the technologists, to avoid having errors or mistakes for us. When it comes to screening with AI, it will involve lesion detection. It can assist in classifying those BIRAS scores or categories. And pretty much BIRAS is a reporting system that is used in radiology that the radiologists use to help describe any type of finding in the breast, whether it's an abnormal finding or whether it's a benign finding or negative finding for breast cancer or any type of breast masses. So we'll just go over the BI-RADS score real quickly. If a patient get a 0 score, that means incomplete. The patient need to come back in for a follow-up mammogram, whether they're doing more mammogram pictures in a different way, or if they're doing breast ultrasound images to determine if something is a cyst versus a solid tumor. If it's number 1, that means it's negative, the test is normal. If it's a 2 score, then it's benign. And if it's 3, it's probably benign, so the patient will need to follow up within 6 to 12 months. If it's a score of 4, that's a suspicious abnormality. A patient should come back in for a biopsy. Number 5, highly suggestive of malignancy. Whatever was found in the breast looks like cancer, so the radiologist will strongly recommend a biopsy. Number 6, if it is a proven biopsy for malignancy and a cancer was confirmed, that would be for number 6. So when it comes to AI and learning breast imaging, there are 2 types, a form of AI. You have your machine learning and deep learning. So with the machine learning, it's going to help the radiologist with the order scheduling and triage, clinical decision support systems, detection and interpretation of different findings, post-processing that information. When it comes to deep learning, it's just going to pretty much talk about how to improve diagnostic accuracy, what is the better outcome for the patient. We have radiomics in AI systems, which the purpose of this is just based on the idea that whenever you are using that machine learning and deep learning, it's going to be very helpful in breast cancer screening. You have that it does extract features representing various activities happening at the genetic and molecular levels. For the breast cancer treatment with AI, it is going to help increase identifying those metastatic breast cancers, and it will help reduce the number of false positives as an outcome. When it comes to which radiology imaging is the best to screen for breast cancer, it is the mammography department. And you also have that computer aided diagnosis, which is used in the mammography department to detect abnormal breast tissue. This is going to help the radiologist discover early signs of breast cancer. So it does assist the radiologist with image interpretation. And this is just showing different examples of when CAD is used and how it can detect cancer easily. So it's pretty much just a double eye, or the radiologist uses it in combination with them already reading the images. So it just serves as just like a double check in the image. You have your calcifications in the breast, which is calcium deposits in the breast tissue. You have different forms, macro calcifications. Micro calcifications can be an early sign of breast cancer. It doesn't have anything to do with what you eat or drink. If it is calcification, then a patient will have to have a diagnostic mammogram, and it's done in different ways where we use like a small powder to zoom in on this area just to make sure that we can see the size and the shape and the borders of the calcification and the numbers as well. All right, this is the magnification paddle and the magnification stand or mag stand that we use in breast imaging or the mammography department whenever calcifications are found, or we call them calcs. And then more information on how AI is used in the mammography department, pretty much helping detect breast masses, breast density. It can make sure that images need proper positioning for the next time if it wasn't as good that time the patient came in. Now with AI and digital breast tomosynthesis, which is a 3D mammogram. So we do try to encourage patients to have a 3D mammogram, especially if a 2D mammogram was ordered. A 3D mammogram just shows a lot of the breast tissue, especially if a patient has small calcifications in the breast if they have dense breast tissue. So a 3D mammogram is very important, and in combination with AI, it can have reduced the reading time with digital breast tomosynthesis. And this is just an example of the dense breast tissue. You have different ones, whether it's fatty, scattered breast density, heterogeneous, or dense breast tissue. There are new FDA regulations when it comes to the breast density. So pretty much whenever September 10th happened of 2024, all mammography facilities were and is required to notify patients about the density of their breast. And this just so patients can know, hey, this is how dense your breast is or whatever. Okay, so how reliable is AI? Do you think, if you can put in the comments if you like AI or if you feel like it is reliable? I'm curious and interested to know what your thoughts are. So when the problem occurs or comes with AI, it's whenever you have data on people belonging to different socioeconomic conditions. So that gathering that information, it can determine whether it's accurate or not. So a common code must be available for everyone, and the data should be given and shared equally to everyone. It is approved by the FDA, and it does have 15 approved models for screening mammograms. So we have different FDA models. We have interpretive applications, lesion detection, we have diagnosis and triage, density assessment, risk assessment, image quality control, image acquisition. It's just different forms of AI models with FDA. So there are challenges with AI, and let's say one of them is the patient history being saved as an electronic health records in various hospitals. Can you easily retrieve it and detect it? How trustworthy is the patient's information? You also have another challenge is AIs is can you build that trust with doctors? Do doctors want to use it? Are they open to learning AI or learning how to use it when it comes to reading this type of radiography exams or helping with this type of procedure? You have different ethical risks with AI, data confidentiality, privacy violation, giving patients more control over their diabetes, consent, misuse and abuse of AI technology, and you also have poor design. So we must remember our ethical principles in patient care, which respect patients and making sure they can make their own decisions. Make sure that you're doing good and doing well to everyone, treating everyone fair. Do not harm or injure anyone. Limitations with AI is just the concern that there's not enough information in the clinical practice, and you also have concerns for AI replacing many roles, especially the ones that are carried out by the radiologists. But I know for a fact it cannot replace my role as a technologist because we're very important and useful just like radiologists, just like nurses, doctors. All of us is very important, especially whenever it comes to giving patients their results. If a patient was just diagnosed with some type of cancer, whether it's breast, lung, kidney cancer, all of us, we always come to the patient and we provide that reassurance that we will do the best we can to get them the best treatment options, or we will take the best images that we can so that it can provide a better treatment option. So, even though AI is everywhere, it just won't replace us, or I don't see it replacing us. But if you've made it this far and you're paying attention, because I know this presentation is long, can you put in the comments if you think AI will replace your job? whatever job you doing, you can put in the comments, hey, I work in this department. I think AI will replace us. Or I work in this department. I don't think AI will replace us. Just let me know in the comments what you think. So how can you overcome the AI challenges? You can provide or do more research, upgrade the technology, train your employees, make it more accessible, have a good computer power outlet, and invest in the data, spend the time and the money invested in what is AI, how to use it, how useful is it in your department. The future of AI when it comes to breast imaging is going to be used for lesion detection and accuracy, making sure that we have an efficient workflow, faster access to the imaging results, and it's going to help reduce those false positive markings. Okay, we have pros and cons with AI. We'll start with the pros. It can have reduced human error, reduce fraud and theft. It's available for you 24/7. Your digital assistants, buys. It can help perform repetitive job duties. For your cons, it's very expensive or it can be expensive. Your employees may feel like they will not have a job in the future. No ethics. Will it make humans lazy? And will it make humans not want to work or use their brains? Also, let me know in the comments what you think about that. Will robots take my job? When I'm looking at this from a technology standpoint, like I was saying a few minutes ago, it can't replace a technologist's job. I don't even think it can replace a radiologist, a doctor, a nurse's job because we still have to come in there, talk to the patient, reassure them, that everything will be okay, by touch and feeling. Patients like that reassurance. They like those hugs that everything will be okay. So I don't think it can replace my job as a technologist because when I'm working in the mammography department, the patient cannot position themselves. They cannot put their own breast on the machine. There has to be a technologist there that is doing it. Even in CT and MRI, there has to be someone pressing those buttons to move the patient in. So just let me know what you think. Okay, this is going to just be a basic overview of how we position in the mammography department. And I'm going over like a basic overview because image evaluation will be used by AI. So let's just talk about the basics first. So we have our CC view. This is whenever the patient is facing the machine. The MLO view would be like the patient would be angled at 45 to 50-degree angle, kind of sideways. And then for the final image, you want to make sure that you include a nipple and profile image on at least one image, as much pectoralis muscle as possible. Make sure that you have a good inframammary fold or IMF. Try to get as much breast tissue as possible. If you run into any type of limitations, document it in the patient's chart. Make sure that you take a separate image. See if that radiologist that you're working with prefer that repeat image being taken in 2D versus a 3D image. So whenever AI is helping positioning in radiology, it's going to pretty much flag whatever images is poor positioning, which image needs to be improved, which image need better image quality. Is going to help reduce the need for repeat images from the technologies. And then it's also helpful with preventing the patients from having to come back in. Sometimes patients live far, so it's going to help prevent them from coming back in. When to repeat a mammogram. So your final image should have at least one picture with the nipple in profile, meaning the nipple is pointing outward of the breast. The nipple is not rolled in the breast tissue. If it is, take another picture where you're trying to get the nipple pointing out of the breast. And then this is because if you look on this image where I have the blue arrow pointing where I say this is the nipple, If you don't know any better, this can look like a mass or some type of abnormality. So getting an image without the nipple in the breast, it will let the radiologist see if this is some type of abnormal tissue versus if it's their nipple. Document any limitations, especially if a patient has a pacemaker, if they cannot position correctly for a certain picture, if they're in a wheelchair, if they have a cane, if they can't hold their breath. So if they have a chemo port and you can't compress as much. So just to make sure you document every limitation that you have inside the patient chart. This is helpful for the radiologist and for the technologist performing the mammogram in the future. You also have this chemo port right here. If a patient has some type of cancer, whether it's breast cancer, liver, kidney cancer, they will probably have a port, or depending on their treatments, they could have a port placed. And then if a patient has a wheelchair, you can document that it was difficult positioning patients because they're in a wheelchair. And then this is just an example of how you can position a patient, especially if you're not as comfortable with handling patients in a wheelchair. Always provide a pillow or a cushion behind their back, especially to get them upright a little bit more. And then just try to get the best images as possible. Call for help before the patient leave, especially since they're in a wheelchair. Ask the radiologist, do they need you to repeat the images if it's okay, or if they need you to repeat something. Okay, you have your quality assurance with AI, which is going to help take away some of that stress, especially whenever it's like that time of the year where you have to do, you know, different quality control tests, or if you have different inspections. It can help focus on your position errors, minimize the technical recalls. So it's good at flagging what needs improvement and what does not need improvement. Make sure that you are communicating with the radiologist. This is very helpful because when we communicate and put notes in, we can say the patient moved because they couldn't hold their breath, or they have knee problems, or they have back problems. So if AI flags that image, we also have notes in saying why the patient moved, why we couldn't get correct positioning, or maybe an interpreter had to be called before we took the mammogram images, but we couldn't use a interpreter during the mammogram images, because if the phone is over there and then you have your patient over here, then the patient probably can't hear the interpreter. So just communicate, put notes in, because if AI's, results are matched up with your notes, it can all come together and make sense. Now we are going to talk about how AI is used in the clinical practice with technologists and for radiologists. So this is like a journal entry that I found online where it goes over AI and how it's used in the clinical practice. So if you want to view this article, you can. Okay, so we'll start with the potentials. So with AI, with the help for technologists and radiologists, it can improve the performance. So as a technologist, because I'm a technologist in the mammography department or the radiology field, it can help us avoid positioning errors, limit or minimize how many times we have to call a patient back because of technical repeats. It can help flag those risks, help with workflow, reducing patient wait times, limiting and reducing mistakes and errors. So you have some concerns, and some of the concerns is, will it perform? Did it cause more work than provide any help? Did it provide fulfillment to help the radiologist diagnose and detect breast cancer? Will it really work? Is it great for lesion detection? So you do have those concerns with AI. For the risk assessment, this is what we use when I work in the mammography department. When patients come in, this is going to kind of generate a questionnaire for them. They have to be as accurate as possible with putting in this information because it gives a score at the bottom where it's a TC life score. And at my facility, if that number is above 20%, then the patients get a call from the high risk breast clinic. And it's pretty much just going to say, hey, you're probably at high risk because of the information you put in. We think you should either get a genetic test, get a mammogram, alternate breast MRI 6 months apart. Maybe you should have a yearly breast ultrasound. So it gives you all that information, and someone would call based off of these results. You do have challenges with AI for clinical practice. You have bias, algorithm performance, physician trust, patient trust, the cost, medical education. So this is just different bias you have with AI. Um, Using that large data sets for training, validation, testing, choosing an algorithm that is trained on diversity populations if it can be possible. You also have the algorithm performance, whether it's good or consistent with a broad or narrow, how it can maintain that consistency. Which population does it work best in? Are you testing all of the populations? So I am curious to know if you all uses AI. We use AI some type of way, so just let me know how AI is helping you at your house or at your job. Is it taking away some of that stress or is it causing more stress? Okay, you have your physician trust. Will this cause the physician to lose their own skills? Are they relying on AI too much to where they're not relying on their own skills? You have the concern for data breaches. So, will the patient's information be protected? How much will it cost? Will it be expensive? Will it be worth it? Will you have a lot of people training? Are they getting a lot of information from it and it's not just a waste of money? Or are we really using AI? And you will have to conduct some type of meeting or training, especially with all of the staff that will be using AI, whether it's the radiologist, the techs, manager, supervisor, anyone from the front desk, IT. So everyone who will be using it or will come in some type of contact with AI, they need to be trained. Educate your staff on how to use AI. Make sure that anyone who is training on it know how to interpret certain findings, especially if what if AI misses a cancer. Don't rely solely on AI. Also rely on your skills. Don't just rely on the AI software. And then this is more information from a journal entry I found online. If you want to go online and review this. So this is just going to talk about different categories whenever it comes to breast density, which I've already discussed how category A, your breast is entirely fatty. You can easily see through it versus category D, where it's extremely dense breast tissue. You probably can't see as well through it. You have different tools in AI that can help provide a lesion marker, detect suspicious scores or suspicious abnormalities. And you also have another example of the breast density. And is AI able to predict the risk for a tumor assessment? How well can they recommend if a patient should come back for a breast ultrasound or a breast MRI? Now we're going to talk about the key trends in breast imaging when it comes to new changes and updates. For the latest trend, you also have 3D mammograms being mainly performed, and then you have those supplemental imaging like a breast MRI, a breast ultrasound, 3D mammogram. AI is growing. It's very popular now. A lot of people's talking about it. A lot of people's using it. Now, for the four key trends, we have more changes to everything since COVID. A lot of things is more digital now. You have increasing knowledge and research. So I will say, a lot of things are changing. So just try to keep an open mind, stay positive. You can get over it or get over the hump by being willing to learn. Okay, trend number one, we have more people getting 3D mammograms. It's better for detecting those abnormalities, those asymmetries, suspicious areas, small, tiny calcifications in your breast. So that's the biggest trend. Supplemental imaging, your breast MRIs, your breast ultrasounds, alternating whether you're going to have a mammogram in January, a breast ultrasound, or a breast MRI in July. So the role of AI in mammography, it can help, scan the breast images for detection of suspected cancers. It can help flag and categorize which images is more important. So if you have a patient that just came in on Monday at 3 o'clock p.m., with they just had, let's say they had a screening mammogram and everything is normal, but you have a patient that came in, let's say at 3:30, and AI flagged that they have breast cancer. So AI can move the 3:30 patient images up before the 3 o'clock so that it can be read, so that the results can be given to the patient quickly, especially since 3 o'clock patient results are normal. Lower reimbursement issues, especially if facilities aren't using AI as much. Make sure that you are staffing accordingly whenever you do have these situations where if a technologist is short staffed, they probably would not perform as well. So you're gonna have AI flagging more mammogram images because if a technologist is burnt out, then they're not performing at their highest capabilities. They're tired, we're burnt out. So that may be the day AI flag a lot of images for improper positioning, patient motion, technical repeats. In breast imaging, let's talk about just a quick overview of MRI because I can do a separate video if you want me to on MRI and breast MRI. So basically, MRI is a big giant magnet machine. It can image any body part. When it regards to the breast, it can be used for personal history of breast cancer. A patient was just diagnosed with breast cancer. Someone who has breast implant problems. It can be used for different areas of the brain. You can be It can be used with contrast, without contrast. It can take anywhere from 30 minutes to an hour to perform if a patient follow the instructions and hold still, if the technologists give the instructions properly so that the patient can understand. Okay, with the breast MRI, the patient will be on their stomach. It will take about 20 to 45 minutes to perform. Images will be taken without contrast, and then we will take images with contrast. The patient will be given some type of earplugs or headphones because it will be loud. And if a breast MRI is ordered, the patient is at high risk for breast cancer, dense breast tissue, personal history of breast cancer, checking to see if the cancer has spread it to different areas such as the lymph nodes. To prepare for your MRI, tell the technologist before you even go inside the room if you have allergies to contrast, if you have a pacemaker, stimulator, if you're claustrophobic. Um, we have to know all of this because I perform MRIs as well. I'm also an MRI technologist and I perform breast MRIs every time I work at MRI. Breast implants are allowed, but breast expanders aren't. Breast tissue expanders. So this is just an information just clarifying and verifying that breast tissue expanders is not safe for MRI. So if a patient does need an MRI and they do have this in their breast, then they have to have the MRI either before it get put in, after it get put in, or after it get removed, because it can't be they can't have an MRI with the tissue expanders. All right, so if a patient does have some type of metal or implants in their body, we have to verify. We have to make sure that it's MRI conditional to go inside the room, meaning it meets certain conditions if it's not MRI safe. With MRI, AI can reconstruct those MRI scans into high quality images. It has the ability to help the radiologists improve their diagnostic performance, especially whenever they are distinguishing cancer lesions from non cancerous lesions. You also have your DynaCAD software. We send a lot of the breast MRI images to DynaCAD, so it enhances the breast imaging workflow. It is helpful for radiologists. I know when I work in MRI, we send our images to DynaCAD, and the radiologists also view it, or they do whatever they need to do on DynaCAD on the software with the breast MRI images. Now, breast ultrasound, just a brief overview. So, if you don't know what breast ultrasound is, this is how it is performed. It doesn't use radiation, it only uses sound waves. So, it can be used to image the breast, especially if a patient had an abnormal mammogram or abnormal breast ultrasound. It can be helpful if you're doing a needle biopsy or aspiration of the breast. If a doctor orders a breast ultrasound, something was seen on the screening mammogram, just a follow up from an abnormal mammogram, dense breast tissue. If a patient comes in with a lump, or if a patient comes in and they're younger than 25 and they can't have a mammogram. The risk that is associated with breast ultrasound is pretty much whenever you have technologists working under or on the machine doing the scans that aren't trained properly or aren't comfortable. So just make sure the tech who is doing the scans are trained properly and they know how to operate the machine, recognize those abnormalities. This is a breast ultrasound scan if you haven't seen one before, but it can help shorten the exam times and improve how accurate the lesion that was detected, especially if you have a technologist who is working or training that, isn't comfortable, because sometimes it takes a lot of repetition to get comfortable with performing breast ultrasound. That's why the technologist who is doing it, they should be well trained and comfortable just so nothing get misdiagnosed, or make sure if a lesion is in the breast that it get found. Okay, whenever you do image the breast with AI, it will improve the workflow. It's going to serve as a second opinion pretty much. So this will be very helpful in detecting anything that's abnormal. Okay, it can detect lesions in the breast. The radiologist's workload is reduced because AI is going to help improve the workload efficiency. And by doing so, it's going to help overlook any findings or misinterpretation errors and give a second opinion. It can help the radiologist categorize a lesion as benign or malignant. And then also, this is just going to reiterate that mammography is the gold standard at detecting breast cancer, although, we still use breast ultrasound and breast MRI for second looks, second checks to provide, a closer look at some type of abnormality that was seen on mammography. But the mammography and mammogram machine is number one whenever a patient is coming in for any type of breast related concerns, especially if it's like a screening mammogram, or if they need a diagnostic mammogram, a lot of the time the doctor will order a diagnostic breast ultrasound as well if it's needed. Other imaging modalities used in radiology, you have PET scan, which is going to check for a potential spread of cancer, whether it's breast cancer, cancer from liver, pancreas, brain cancer. This is how a breast will look on CT images. Of course, whenever the patient have to come in to detect breast cancer, it's going to be with the mammography machine. But if a patient comes in and they have a chest pain or a cough and they need a CT scan, then their breast will be in the images, and the radiologist can notate any tumors, any infections, any problems that appears with the breast or the breast implants. And then you have another image of, I have the arrow point to the right breast and the left breast. This patient was given iodine. That's why you see some of the white areas, especially in the heart. And the pathology on this image is a hematoma from this website that I obtained this from. And then you have the images pointing to, or the arrow pointing to the breast implants. So I would like to know your thoughts on AI. I did talk to a lot of technologists, mammo technologists, and they are open to using AI. They would love to see how it can help them with motion, positioning the patient correctly. They're curious about how AI works. With the radiologists, they're open to using AI, but they are a little hesitant. They would like to do more research about it. And their opinion right now is CAD works great at identifying abnormalities and lesions within the breast. For the key takeaway um, about this video, you have different people who is open to learning, who may not be as comfortable right now, who want to do research. We all know AI is used every day, but if you want to let me know in the comments if you think it's a great idea or not, feel free to put in the comments if you would like to use it or if you are using it or think it is helpful. And other than that, thank you all for watching this presentation. Let me know if you have any questions or if you enjoyed this video, feel free to give it a thumbs up. These are my resources. Thank you all for watching.